the great room. Please call 844-322-3246 to make your reservations, and reservations are required for the Murder Mystery, Saturday, January 19th at 6 p.m. at Echo Bluff State Park.
At the KSMO studios, time for our spotlight on the Salem Memorial District Hospital. And we have Cathy Haynes with us again. Cathy, you're becoming a regular.
Good morning.
This is good stuff. I like it. Anyway, but it's that time of year, and I know we're starting to get some pockets out there. And I saw just the other day a bunch of states are now, showing a lot of different cases of flu being reported. And I know that I think my brother just got the flu up in St. Louis, so it's out there.
It is.
Time to be making yourself aware that you don't want to be getting the flu, and
Absolutely.
you want to do everything you can to avoid it, but you still can get the flu. Now, hopefully you've already had your flu shot, right?
Hopefully everyone has had their flu shot. Absolutely. I do monitor the flu through the hospital, what comes in through the ER, and of course if there's anyone admitted into the hospital. So I do monitor that, and we work with the state and report those numbers. Compared to last year at this time, Salem numbers are
way
considerably down, so that's a great thing. Yeah. Again, we talked about hand washing, I believe, last month when I was here. It's one of the most important things you can do to protect yourself besides the flu shot. But, we're lucky right now. The numbers are low for us at this time.
Yeah, last year, if you remember, we were really, really, really cold, and people stuck around inside next to each other, and, get the idea.
Doesn't take much.
And then it can easily spread, and you don't think too much about it, but you do need to be aware of it, and it can be on any surface. And at this time of year, as you're mentioning, if you've got one case in town, that one can become 4, can become 10
Absolutely.
and 15.
Absolutely.
When you go to the grocery store now, and a lot of businesses, and I'm saying grocery store or Walmart, wherever, they have the handy wipes in there to wipe off the carts and do things of that nature, which is a great thing. But when some people take cans off the shelf and put them back, or take an item off the shelf and put it back, it could be there, couldn't
Everything we touch or breathe, you can
Spread
contract it. So the flu, if you do have flu symptoms, you're most often going to see fever, some chills, cough, sore throat, runny nose. The muscle and body aches is one of the main flags for the flu, and then just being fatigued and really tired. If you truly have the flu, the first 3 to 4 days you are contagious, and that's sometimes when people are exposed and they don't realize what's starting to happen to their body, and that's how we pass it on to others. So definitely.
So I want to ask you, because you're in the business, so I'm going to ask you about all these flu prevention medications over the counter that say, as your first sign of flu, take this and this will reduce your flu symptoms or help eliminate getting the flu, etc. How accurate is that? Or, does it help a little bit, or is it just a little bit of hype, and this is what you probably should have been taking all along?
Well, most likely, hopefully, sometimes people think they have the flu and they really don't.
Right.
Some of those products may help that person feel better, depending on what the ingredients are in those
So lessen
flu
the
products.
symptoms is what you're kind of saying. Okay.
If you truly have the flu, Tamiflu is about your main preventative. It's a prescription medication. It's not going to. It will just lessen your symptoms.
Right.
You're still going to feel cruddy, but it will help lessen the symptoms.
The severity of a flu, and flu can be deadly. So you don't want to mess around with the flu.
Our babies and our elderly people are the most at risk.
But it can happen to anybody. You can get a severe case of the flu, and you've got to, first off, you have to stay hydrated. A lot of people, when they get the flu, they don't want to be drinking anything. They don't feel very good. They don't eat enough, and you still have to eat, but you definitely have to stay well hydrated. You need to kind of flush the stuff out of your system, right?
To rest and to drink as many fluids as possible. Of course, water's going to be the best. But yes, that's the main thing you can do is rest and drink plenty fluids and be hydrated. If there comes a point where the patient is experiencing, confusion, dizziness, just not getting better, maybe some vomiting, those would be signs for a reason to go to the ER. Yeah. Absolutely.
How about fever? I mean, we talked about fever. Usually you do get a fever with a flu. Hopefully you understand how important how important it is to keep monitoring that temperature. When it starts to when it's 100, 101, okay, you're fine. 103, 104, you better be in the ER, right?
Right. And that's really different for every. That is a very individual measure, because some people don't run a 99.6 or
right.
89.6 or, so it depends on their baseline. So some people can have a pretty high fever at 101,
right.
or even 100.8.
Right.
So that person really needs to know their body.
Right.
But definitely if it's above 101 for a period of time, they need to be seen.
Kind of using the 98.6 as a guideline. If you hit 100, you got a fever. And there are things you can take to help reduce that fever,
Absolutely.
Correct? Such as?
Absolutely. You can use products over the counter from Walmart or any pharmacy. To help get your fever down. Absolutely.
But don't overdo it. I mean, I think the thing that a lot of times people have when they have that fever and they want to get better quicker, all right, so you take the prescribed dosage that's on the box, but you don't happen to read further down where it says do not exceed 8 tablets
Absolutely.
in 24 hours.
You want to follow the directions.
Right, so after the first 2 hours, instead of it being 4 hours, after 2 hours, well, if you've dozed off a little bit, you may lose track of time, and they take another one, and okay, well, that's making me feel a little bit better. Maybe I'll take another one. All of a sudden, they've got 6 tablets in 6 hours.
Yeah, we
that's
don't want to
something
do that.
You don't want to be doing.
Then you have other problems. You can have kidney function issues, and
right.
So we want to follow
organs.
the directions.
Yeah,
Absolutely.
a lot of these things do affect organs.
Absolutely.
So, is the best fever reducer aspirin? Or is it Tylenol? What would be the best?
It would depend on that patient, of course,
Okay,
because if
right.
somebody's taking blood thinners, you don't want to give them aspirin on top of that. So, your Tylenols, your ibuprofens. If you have any questions, usually your primary care physician office or the ER nurse can help direct that patient. But it depends really. It's hard to give just a blanket statement because of their medications. So.
I mean, it used to be kind of the old generic term was you have a fever, take a couple aspirin.
Yeah,
right?
That used to be the way it used to be.
Okay, well, I understand. But, one of the neat things that the Salem Hospital has on their website is an you have a nurse. You can actually go on there and you can do a check. If you have a question, I have a X amount of fever. Let's say 100 fever, 100.3. And I'm on blood thinners, what can I take to reduce my fever? You can actually type that in, and you will get a response of a safe way to take the right medication. Is that not correct?
That's true. They will help you with that and guide you.
So instead of trying to figure out on your own, and of course, who when they're ill wants to sit and try and read something and find out. And if you go to WebMD, and a lot of people swear by it, but I've gone to WebMD, and I find different opinions. I just need an answer. I don't need different opinions and, so many different things to look through.
Yeah.
I just need a quick answer.
Well,
you're not feeling good. You don't want to sit there and look at that.
The internet can be a wonderful tool, but it's also it can also not be a wonderful tool.
It can be confusing.
Yes. So if they have questions, they need to contact their primary care.
Okay. So we got a fever reducer in us, depending upon what you might be taking for medication, whether it be aspirin, ibuprofen, Tylenol, something of that nature. So you got your fever in control, but you still need to be drinking a lot of fluids.
Absolutely.
And people when they get, as you were mentioning, fatigue, and I remember a long time ago I had a trainer. He says, you want to try and move around. He says your muscles are going to hurt. You just don't want to get up. Hard to get up. But the more you move around, the better off you are, and drink a lot of fluids. Is that true?
Absolutely.
Okay.
Absolutely.
It'll help you get over the flu quicker. Is that
absolutely?
Okay. So he was right. That was
Yep.
back in the 70s, so the guy wasn't too stupid after all. No, he was a really good guy. He was a Marine, and he was our trainer, and he had a lot of common sense things, you know. And a lot of times, as we talk about the flu, as you mentioned, a lot of times things are misdiagnosed as being the flu. You may get a stomach bug and feel horrible, but that's not really the flu.
Right.
You know, and this time of year, there are a lot of things going around, aren't there?
Oh, yeah, always. You know, there's lots of viruses out there, and, you know, it's easy to misdiagnose. Absolutely.
So if we've had the flu shot, doesn't mean you're not going to get the flu,
Right.
but it should lessen those symptoms that
And
we're talking
hopefully the
about.
risk.
And what is let's say we don't have a flu shot, what's the average, in your opinion, what's about the average recovery time to get over the flu, fully recovered?
You know, the flu can take anywhere from 1 to 2 weeks. That's whether you've been vaccinated or not. But the fatigue and muscle weakness can last a little bit longer. So, you know, a couple weeks, that's a long time.
Wow, that is a
Yeah.
long time. So you definitely want to make sure that, you know, you don't do stomach too strenuous too, obviously, because after you're ill, we all know that a lot of times people want to get back out there and do what they did before. They just don't
Absolutely.
have the energy to do
Right.
it.
And our elderly, it's very difficult for them to get back up and going.
So how about now we're getting, let's just say we got past the first few days of the flu, and we've got everything down. Our fever's kind of staying maybe 99, 90 something. Is there a better diet to help us get over the flu? Better, you know, fruits, vegetables, and
Whatever
things
you
of that
feel
nature?
like eating, really.
Well, okay.
For the
I
most
mean,
part. I mean, really.
you know,
If you feel
you know,
like
pizza
eating
and
by
steak
that
and lobster,
point,
right?
if you feel like eating by that point, by all means, you know, that's going to help get your strength back up.
Well, you know the old adage, starve a fever, feed a cold, right? How
That's what
accurate
they used
is that?
to say,
How-
but
you know, I'm throwing a whole bunch of these old things at
yes,
you,
you
Cathy.
are.
So is that accurate?
but
Do we
really-
starve a fever? Just drink it to death, or
Well, most
You know,
people don't feel like eating
well,
when
I
they're
know
that
that.
sick. But the main thing is to try and eat and drink. There's broths, soups, you know, clear liquids at first, especially if they're vomiting. That helps, you know, it reduces the risk of aspiration. You know, our elderly are able to, they're more at risk for pneumonia at that point. So it's really eat and drink, and then once you're feeling better, eat what you want.
right?
You know, absolutely.
But if you have been ill and when you eat what you want to eat slowly because you know your system has been rejecting that food. You
Yeah.
know, if it is, and so you want to eat slowly. I remember my grandfather was a doctor, and he told my mom, dry toast.
A lot of yeah.
Nibble on dry toast. Just get enough. And then he said, take 7-Up and pour it out and leave it outside. Take the carbonation out of it and then sip the 7-Up with your toast. That was back in the 60s and 70s. I'm still alive. So obviously it wasn't bad advice, but that's it. I mean, there was no carbonation at 7-Up. It was just kind of like a little sugary water to try and help give you a little energy, but put that back in. But you don't guzzle it. You know, and you just nibble on the toast just to get something in your system because your body needs food.
Absolutely.
And it needs drink. And of course, he always had water there, but he said with the toast, you may want to put that so there's a little flavor to the toast. So, you know, there you go. You can put that on the SMDH.net site. You know, Dr. Bernstorff recommended this in 1964.
There we go.
You know, but anyway, it was good stuff. I guess one of the things that when we do have the flu and we're getting over the flu is there a timetable to work yourself back into your regular routine? Or is it just as you feel you're able to do it?
I think for most people, after the first week, they're able to get back to their normal routine.
They still may be tired.
They feel,
but,
they might still not feel 100%, but for the most part, I think most people are trying to get back to their normal routine within that.
Okay,
end of
so
the first
but
week.
in what, and we already kind of talked a little bit about this, but in what way, shape, or form would people who have the flu definitely need to get to the hospital? You know, because the flu can dehydrate you in a
Absolutely.
heartbeat. Okay.
Again, if they're dizzy, confusion, you know, if the family members are seeing that there's some confusion that's not normal for that patient, any respiratory, difficult breathing, any of those types of signs, yeah, they definitely need to come to the ER and be checked.
So is there, I was going to say, if a fever lasts for a certain length of time, should they really keep an eye on that and say, okay, you've been at 102 now for 3 days. I think we need to take you in.
Absolutely.
Should that be something,
Absolutely.
because the fever should kind of go up and down,
it should
right?
hopefully resolve with some medications.
So if it doesn't reduce,
then you would need to get to the ER as well.
Okay.
Because there could be something else going on along with your flu symptoms too.
So how long should somebody wait to do? I mean, okay, let's say you're coming down a flu, you feel fever. Most people know when they're getting a fever. You can touch your forehead and you can feel like it's on fire, okay? Or you just feel extraordinarily warm. And then you can kind of feel those symptoms coming on, which I do not want to feel this year, okay? I don't want to do it. Actually, I never want to do all that again. But let's just say you're getting ill and you know that. You take your fever and you got what I kind of call, that's your base temperature. Now that you have felt warm, you now know you're warm. And let's just say it's 99.5. And so I kind of call it my base. Now, I expect that if I'm getting a full-fledged flu, that to go up a little bit. But is there an area where you say, okay, if you've got 99 to 100 and all of a sudden it jumps quickly, would that be a telltale sign to say, wait a minute, you should not go from 101 or 100.1 up to 102.9 quickly unless there could be something else here that we need to check immediately? Or is that something that does happen with the flu?
It does.
That you can kind of wait out a little bit?
Yeah. Definitely, you would want to try to weigh that out. Take your over-the-counter medications, see if that helps reduce it. To go to the ER with the flu, you really putting other people at risk as well if you're if you're during that contagious period of time. But most people want to try to take care of it at home at first. If it lasts more than 24 hours and it won't come down at all with additional medications, then by all means you should get checked out.
Or should they go to family clinic?
They can go to their family clinic if it's open, absolutely.
Yeah, because they do have extended hours up to 8
Seems
o'clock.
like most of the time, though, by the time people get to that point, it's the evening, weekend, or but absolutely. And your physician who you are used to seeing may be able to handle something over the phone for you, so you don't have to get out and wait in a waiting room with other people with viruses. So definitely consult your physician.
Always some good options to have there to try and think of. And I guess one other thing that I wanted to point out, a lot of times, and I know when I'm sick, don't bother me. I do not want anybody around me. Leave me alone. But that's not always the best case, is it? You should have somebody periodically checking on you to make sure that everything is okay.
Again, I'm going to go back to our elderly. If they're living alone, they could fall. If they're dizzy, they could be laying in that floor for a period of time. So absolutely, we want to check on our neighbors and our family members.
And a lot of times you don't realize you're getting dehydrated. That just happened to my daddy. We just had to put him back in the hospital. He didn't realize he was dehydrated, and until he got in there, and they had to put 4 bags of fluid in him just to get him back to hydration. And I'm thinking, Dad, what were you, he had a little diarrhea, didn't think nothing about it. Well, he's 94.
Yep.
A little diarrhea, and he's not drinking any water, and he'll have a hot chocolate or something, or a cup of tea, but he doesn't drink that much water, and he's got the situation going on. It becomes very scary, and then he kind of ventured off into the la la land there a little bit. Still recognized things, but he would things got a little bit foggy, let's put it that way. So we got him back, and hopefully he'll be coming home here tomorrow. So very good. But again, this is all very important because you don't want to get dehydrated.
Right.
You can't fight off infection without water.
Right.
And so you definitely want that to go through, and you want to get that fever down. Water it's kind of like your, I always kind of call it like your radiator.
That's true.
You gotta put the water in to keep that temperature steady. Without the water, it gets hotter and hotter and hotter.
You're right.
See,
Absolutely.
I'll allow you to use that if you want to. I won't even charge you. Kathy, always a pleasure that you come in and talk to us about the flu. And again, there is flu season. You have said there are some flu cases that are being reported in Dent County. So please be careful out and about. Always, it may not be a bad idea to take a few hand wipes with you as you go through. You can get the sterilized hand wipes, and they're not a problem. As I mentioned, a lot of the stores now have them as you come in, or they may have a dispenser that you can take some Purell or whatever you need to, hand sanitizer. I guess a ching-ching for Purell, and use that. It doesn't hurt anything, but one thing you don't want to do, don't put your hands or fingers or anything in your eyes, nose, or mouth. If you do make contact, wait till you can wash them.
Yes, absolutely.
And a good thorough washing at that. 20 seconds, right?
Absolutely, that's correct.
Kathy says 20 seconds. You better do 20 seconds. Make sure. And in between the fingers, all over and under the fingernails.
Absolutely.
See, I don't forget.
You
tell me. That's
part
the way we
of
do it.
hand washing.
Very good. Kathy, again, thanks for coming and spending some
Thank
time
you.
with us. Keep it here, KSMO Radio. Our Civic Record is next.
When you play the Missouri Lottery, you may not see where